Yay.
Okay. So today I'd like to talk about why vaccination should be mandated in the United States. In 2010, there was a pertussis or whooping cough outbreak in California that resulted in 10 infant deaths. In total, there were about 9,000 cases reported in the outbreak, which is the most seen since 1947. The areas with the most cases at that time coincided with families living in the area that had opted out of the DTaP vaccine, which protects against pertussis. In December of 2014, an unvaccinated 11-year-old child visited 2 Disneyland theme parks in California. The child was hospitalized about a week later with a case of the measles. Subsequently, a total of 125 measles cases were reported, and they all had one thing in common: a visit to the aforementioned theme parks between December 17th through the 20th. Most of the confirmed cases were children who were unvaccinated due to either personal beliefs or because they were too young to receive the MMR vaccine. In the pediatric office where I work, I have come in contact with parents who do not vaccinate their children because of personal beliefs. Some have serious medical issues, such as severe hearing loss due to frequent inner ear infections. These parents have refused the PCV7 vaccine, or the Prevnar, and also the Hib vaccine, which protects against pneumococcus and Haemophilus influenza type B, both bacterial infections which can cause ear infections. I've also seen children with frequent pneumonias requiring hospitalizations, and have even seen a case of tetanus in a 10-year-old, where the patient presented with severe lockjaw, requiring large doses of antibiotics and hospitalizations. The CDC recommends a vaccine schedule for a reason, and parents should follow it exactly as advised by their child's pediatrician, even though at times it may seem daunting. The Centers for Disease Control, or the CDC, recommends 50 doses of 14 different vaccines before the age of 6. Although this may seem excessive on paper, there's a very good reason for the large amount of injections and oral vaccinations for this age group. It's easier to agree with these mandates when you realize the diseases that the children are getting protected from. I'll provide a couple of examples of some of the diseases that the children are protected from with these vaccines recommended by the CDC. The Hib vaccination, for example, protects against Haemophilus influenza type B. Children get 4 doses of this particular vaccination before age 6. Hib is a bacterial infection that can cause things such as chronic pneumonias, spinal meningitis, chronic otitis media, or ear infections, and also cardiac infections, infections that can jeopardize your heart function. Children get 5 doses of the DTaP vaccine, which protects against diphtheria, tetanus, and acellular pertussis. I've already mentioned what a disease like pertussis can do to an unimmunized community, but diseases like tetanus and diphtheria can also be fatal to unimmunized infants and children. Diphtheria is a serious bacterial infection that can cause severe damage to your renal system or nervous system, and tetanus is another severe bacterial infection that affects the nervous system and can cause joints and tissues to tighten and restrict, such as in your airway. As you can see from just a few examples, these diseases are incredibly serious, and when you have a child who is too young or immunocompromised, such as a cancer patient, who cannot receive the vaccines, it's imperative that every able child and adult be fully immunized to reduce the risk of harming the weakest in our society. There are some exceptions to the thought that all should be vaccinated. Some people, due to serious medical conditions or age, cannot be vaccinated even if they wanted to be. To start, infants under the age of 6 months have not received their full doses of the major and most important vaccines recommended by the CDC, such as Hib, DTaP, MMR, and more. For an infant to be exposed to something like pertussis or measles, for example, it places them at risk to develop severe respiratory or cardiac symptoms that can be fatal. Another group of people that cannot be immunized would be those who have an autoimmune disease, such as multiple sclerosis, arthritis, or lupus. These diseases cause the body to attack its own healthy cells. Therefore, their bodies cannot elicit the correct immune response to a vaccine as intended, as their immune system is already malfunctioning. Another group of people that hits close to home is cancer patients and the elderly. These groups of people have a very weak immune system to start, and contracting one of these serious diseases can be extremely dangerous. In conclusion, I firmly believe that vaccinations should be absolutely mandated in the United States. The rise of diseases once thought to be eradicated or close to it is a direct result of parents deciding against the recommended vaccines by the CDC. Children should not be able to enter daycare, preschool, kindergarten, and so on without completion or compliance of the schedule of CDC recommended vaccines. There is far too much risk to allow children into the community who have not been vaccinated. There are exceptions, of course, but these individuals who cannot safely receive vaccines would be much safer in the community if all others were vaccinated. Thank you.